Where does the pain come from during laser or IPL hair removal? Well, let's look at the skin first. So we have the epidermis and the dermis, and just between them we have the basal layer where the melanocytes mostly live and where they generate melanin. This is at the junction between the epidermis and the dermis. This is important, as you'll find out a little bit later. The pain nerve receptors themselves are just below this basal layer, as you can see here. So they will pick up any heat which is transferring through the epidermis, which is only around about 0.1 millimeters thick, and signal to the brain if it's getting a little bit too hot. Now, the dermal temperature is typically somewhere around 37 degrees Celsius, while the pain nerves will trigger at about 45 degrees Celsius. That's only an 8-degree difference. So you can see that it doesn't take an awful lot of heat at the skin surface to trigger pain within the skin itself. So if you're firing in some laser or IPL light energy, then what happens is that the melanin in that basal layer will absorb a significant amount of light and generate heat there. This raises the temperature, which we feel as pain, as you can see here. So the temperature, the heat energy flows outwards from the basal layer, and because the thermal pain receptors are just below the basal layer, they trigger fairly quickly. This is the pain that we feel during laser IPL hair removal and other treatments. So what we need to do is to pre-cool the skin before we fire any light energy at it. The dermis is composed of about 70% water, and this means that it can cool about 20 times faster through water than through air. So if we apply a water-based pre-cooling mechanism of some sort at the skin surface, then heat will flow preferentially to that cold surface. This could be either a gel pack or wet flannels or cold packs or anything at all. Anything that's colder than the skin. As a direct consequence, the pain nerve receptors just under the basal layer, temperature of those will also drop. So clearly, the more pre-cooling we apply at the skin surface before we fire the laser or IPL, then the colder the nerve endings will be, and we can increase that gap, that 8-degree gap, to hopefully a much larger margin. Then we apply the light energy, and the basal layer becomes hot, and the dermis will become a little hotter too. So now we've got a lot of heat energy in the skin. If we don't apply some cooling at the surface, that heat energy is effectively trapped, because the air is such a poor conductor of heat that the heat energy cannot escape the skin very efficiently. So having something cold, particularly wet and cold on the skin surface, will draw out a lot of that excess heat energy that's sitting in the dermis. Now, darker skins have more melanin in the basal layer and also in the epidermis above the basal layer. So that extra melanin will absorb more of the incoming light energy, which means you're going to get higher temperatures in the basal layer and the epidermis. This will lead to more pain and to more damage, more blistering, etc. So darker skins need more pre-cooling to counter that effect. So basically, the darker the skin, the more pre-cooling you need. It's as simple as that. Light penetrates into the skin according to its wavelength. So blue light doesn't go too far, it pretty much only reaches the very top of the dermis. Green gets a little bit deeper, yellow and red deeper again. So all of these lights, all these wavelengths will be absorbed by the epidermal melanin, and so will induce thermal pain. Now, blue light is much more strongly absorbed in melanin than red. So this means we'll get more pain in the epidermis, or due to epidermal melanin rather, for the same fluence. You apply the same fluence in red or blue light, the blue light will be more painful compared to the red or yellow or green lights. So you have to be more careful with the lower wavelengths. Essentially, it just means that you need to apply more cooling as the wavelength drops. Another consideration is that the melanin concentration in a black hair can be up to 20 times the concentration of the melanin in the basal layer in a light-skinned person. So consequently, when you fire in the light energy, the concentration of melanin in the hair means it will absorb a lot more energy than will be absorbed in the basal layer. So overcooling of these hairs is virtually impossible. When you get that big a difference between the concentrations between the hair and the skin, it's very difficult to overcool. Now that changes obviously as the skin color darkens. So if you have black hair and black skin, then the concentration difference is only about 2.5 times, nowhere near as much as pale skin and black hair. So again, that points to more cooling in darker skins compared to lighter skins. Just be careful though that you don't freeze burn the skin with a little too much cooling or ice cooling. So basically, in summary, cooling is absolutely critical when treating particularly hair using light energy, and that is both before, during and after the treatments. When you think about it, we're trying to deliberately instill some kind of thermal damage in the hair follicle to kill the germ cells, but at the same time we run a risk of creating thermal damage in the surrounding tissue, which we don't want. So we have to mitigate that by applying a sufficient amount of cooling before, during and after. And the nice thing is that the more cooling we apply before the treatments, the colder the pain receptors become, the colder the dermal tissues become, so we can use higher fluences, which does translate directly into a greater rate of success. Thanks for listening to this. There are other videos you can watch on our site at Laser-IPL guys on YouTube, and keep your eyes peeled, and hopefully we'll have some more stuff coming quite soon. Thank you.